opportunity to chair this, and it's my privilege to introduce Dr. Sanjay Dhawan. He's also MBBS from Mananazar, and then did diploma from Mananazar, then a MS in Ophthalm from Lady Harding, and he's been all over Delhi and one of the best surgeons. Sir, you'll be happy to learn what I'm going to say next. The biggest testimonial for him is that he has done cataract surgery for 3 members of PFI who are present right now. And all are very good. And I had referred them. 2 others who are here could not go because of panel issues, so that is there. And sir, this is the biggest testimonial. So without wasting time, he's a great singer also. Sir.
Yes.
Sometime we'll have that too. And I think we concentrate on the academics, sir. And thank you so much for doing this CAV for us.
Thank you very much for your kind words. Good evening, everyone. And thanks, Musician Forum of India, for this opportunity to speak to you guys. First of all, बात हुई थी शायद कुछ engagement की. I think इसको engagement पे रहने देते हैं. That is the best period of any relationship. Let's not get married now, because that leads to complications. You agree?
We'll ask your wife.
She's suffering the complications now.
We will ask her.
Yeah. So I'll be talking about a very new topic of ophthalmology, which is called the femtosecond laser eye surgery. There's a lot of hype about this laser because it's a very, very advanced form of doing cataract surgery. Cataract surgery has progressed from the days when couching was done, then intracapsular surgery, then extra cap, then phacoemulsification, and now we have got the laser, which is used in not just cataract surgery but other surgeries also. So what is this laser? This is an infrared laser which is delivered in very, very short pulses, in short pulses of a few femtoseconds. That's why it's called the femtosecond laser. And it's delivered very, very fast, very, very pointed. And basically what it does is it cuts. It's a very, very refined knife, you can say, which can cut in the depth of the eye at micron levels of measurements. And it cuts in the transparent tissue and also the opaque tissue to some extent. And cuts by what is called photo disruption. So where is it used? There's a lot of hype about it's maybe called blade free. Now, blade is not bad because we've all been using blades and knives, but there are other advantages of this laser which I'll talk about later. It is used in LASIK surgery, cataract surgery and cornea surgery mainly. So in LASIK, what we do is we lift up a layer of cornea called the flap, and underneath that flap we do reshaping of the cornea to correct the refractive error. And we are talking about a flap which earlier on used to be about 160 to 180 micron thick with the help of a blade. With the help of this laser, that flap is just 100 micron thick. So cornea in the center is just about half a millimeter thick, 500 microns or so. We lift up a flap of 100 micron, then we reshape the cornea by evaporating again a few microns, and we put this flap back, thereby correcting the refractive error. So to achieve that level of precision, when we are talking about microns, we need a tool which is very highly sophisticated and precise, and that is where the role of this laser comes in. So it is safe, it is very accurate and gives much better results. In cataract surgery, we make, earlier on we used to make a 10mm cut to remove the cataract. Then with phacoemulsification became what 3.2 and 1mm side port. With this we make an incision of just 2.2mm and 1mm side port. And this incision is very specially configured. It is first goes in, then horizontally and then goes in again. So triplanar incision. And now imagine a corneal periphery which is about 800 micron thick. You have to make an incision which goes into precisely 3 planes, a triplanar incision, so that it remains watertight and it does not alter the topography or contours of the cornea, thereby does not lead to any astigmatism. So with femtosecond laser, this incision can be fashioned in a very, very precise way. Though with the hand, with blades, we were making this incision, but with precision and repeatability becomes much better with this thing. Then we make an opening in the capsule of the cataract, which has to be exactly circular and exactly in the center, about 5.5 to 6mm in diameter. With hand, with the needle also it was possible, but it was very difficult to make it exactly the same size, exactly circular and exactly centered. This laser, which is machine controlled, helps us make this capsulotomy in a very, very precise and accurate manner. Thereby, it leads to proper centering of the lens which will be implanted in after the. The nucleotomy, that is the cutting in the nucleus, also is done by the laser. Then we remove the nucleus and the capsule, wash it off, and implant the new highly sophisticated lenses. There are various options in lenses which are not part of the scope of today's talk, but there are lenses which are monofocal, trifocal, extended depth of field. For those high-end lenses, it becomes even more important that they should be centered properly in the capsular bag, and femtosecond laser helps us achieve that. So thereby increasing the safety, accuracy, and better outcomes. When I say better outcomes, I'm not talking about Zameen Asman ka antar. I'm talking about 5%, 10% increase in the quality of the outcome, in 5%, 10% increase in the safety and the final results. So every few percentages, are important as far as the vision and eye are concerned. It also helps us in corneal surgeries, keratoplasty. Earlier on, the keratoplasty was done by manual incisions. It would lead to deformation of the cornea, leading to high astigmatism, but with the femtosecond laser, all those cuts are much more precise and the astigmatism is much less. So corneal rings can be implanted in the cornea, ciliary therapy, tissue adhesion. All this is achieved with much greater precision and with much better visual results. So basically the advantage is in terms of safety. So the rate of complication goes down. Accuracy, because we are working in very, very small level, it's actually very micro surgery, so accuracy increases and hence the results become better. So this is our OT at Max Function Park. On the right you will see the femtosecond laser machine, on the left you can see the examiner laser machine. I should be able to show you a small clip of the OT also. So a very nice and sophisticated OT has been built at Max Panchit, and with the latest technology in examiner laser, this is the examiner laser machine, which does the reshaping of the cornea for LASIK. This machine is by a company called Bausch & Lomb in Tineo. This is the femtosecond laser, again by Bausch & Lomb Victus, which does the cataract, refractive and the corneal surgeries. We can stop it here now. So, sorry. So we have got a Max Institute of Eye Care at Max Panchit Park, and where we cover all the subspecialties of ophthalmology, namely cataract, refractive surgery, glaucoma, retina, oculoplasty, cornea, preventive ophthalmology, pediatric ophthalmology, squint and all. Everything is being done. So Max Panchit is one stop for all eye-related issues. We have very good team of very talented people. Two of my colleagues are here with me. One to come here, Dr. Nikhil and Dr. Turaj. So I take care of cataract refractive surgery along with Dr. Amanju. For retina, we got Dr. Nikhil Pal, Dr. Rakesh Kumar and Dr. Charu Mittal. For oculoplasty, we have Dr. Rituraj Bhagwa. For glaucoma, we have Dr. Tarun Kapoor. For squint, we have Dr. Dipali Garg. For cornea, Dr. Sonika Gupta. And for preventive ophthalmology, Dr. Ajit Verma. Our institute is now into education also. We have started a course on BSc Optometry, which is a 3-year proper bachelor course started this year. We are also teaching undergraduate MBBS students. There's a college in South America, and the students for the clinical postings, they come to Max, so we take care of the clinical posting and the clinical
Deven, you should stop now. We have Dr. Tuli and Shri to introduce.
Correct, sir. Thank you, sir.
Thank you.
Thank you very much.
Excellent. Shri, please introduce Dr. Sarvi.
Sir, just to summarize, I think...
Summarize after the talk.
Sir, so femtocataract, sir, is if we stick to cataract part, with this, I think the initial package vis-a-vis the manual cataract surgery versus femto additional is about 40,000. So about 40,000 extra for the package, the rest depends on the lens. So excellent, I think this machine is revolutionary because it is used for LASIK, chashma hatane wala, cataract and many other things. But for day to day, what we need is cataract and LASIK. It is all available at Max Panchit. Thank you.
मेरे 2-3 बड़े छोटे-छोटे सवाल हैं और कॉमन मैन के सवाल हैं सर. When we send the patient to an ophthalmologist, they say यार फेको करवाना है क्या? तो सर मुझे फेको से वो बचपन की फेको याद आ जाती है. Actually ये फेको क्या होता है ये बता दीजिए.
So phaco is phaco emulsification, where we use ultrasonic waves to emulsify the hard nucleus and then we remove it. So through small incision. And in femtosecond laser, all these things are done by femtosecond laser. So the term, full term is phaco-emulsification, not just phaco.
Not just phaco. No? So the second thing is, they always, the patient comes back and tells us, Doctor, वो foldable lens के लिए बोल रहे हैं. I don't understand what is foldable business and what is unfoldable.
These days, if we do incision, small incision surgery through 3 mm or less, we have to plug foldable lens only. To use a non-foldable lens, you have to have a larger incision of about 5.5 to 6 mm. So these days, people don't go for it and we don't advise it.
Sir, as a common man, physician practicing in a poor area, what should the kind of budget should I give to my patients with bilateral mature senile cataract and you do the surgery in one setting with foldable lens? So, क्या package है?
We don't operate both the eyes together.
Okay.
We give a gap of about 2 to 4 weeks between the 2 eyes. That's one. And package varies hugely from center to center, from place to place. At Max Healthcare, the package is in the range of about 50 upwards.
For one eye?
For one eye.
At one point?
Yes.
Right. So it's about 1 lakh for both the eyes?
Both eyes. And we, the reason why it's more expensive is that we use very high-end lenses. We do not use low-end lenses, and we use disposable material. So the blades that we use also are very, very expensive blades. We dispose them off half the way. So
50,000 per eye is without femto.
Without femto.
It's the manual.
Yes, it's the phaco-emulsification.
Yeah. Dr. Adi sir.
Sir, if the surgery is done for the removal of glasses, say at about 30 years of age, what do you think the glasses can reappear, or for the near period the patient has to use glasses maybe at 50 or 60 years of age, or
So at the age of 45, the patient will still require near glasses. Because presbyopia is not a refractive error. Presbyopia is basically weakness of the focus station. So that comes up with age in any case. So people who undergo LASIK at a young age, they need glasses for near work at the age of 45.
Sir is talking about myopia, sir, which will come back in 5 years.
No, so this is one aspect that the presbyopia. Second is regression of the effect. In some cases, some slight regression may happen. Why? Because the LASIK does not address the process of myopia. It just corrects the number which is there at a given point of time. So if the myopia is increasing, whatever increase with time has to happen, that little number may come up. But if somebody has a very high number to start with, a slight number coming back in 5 to 10 years will not make much of a difference to the patient.
Okay.
I have a question.
So LASIK can be done post-menopause?
So we have a new form of LASIK called SupraCor, which is called presbyopic LASIK, which can correct both the distance and the near number, which is what can be done after the age of 45.
So, Dr. Sanjay, that was a wonderful
A
talk.
lot of people are living without dinner. I do not want anyone to live without dinner.
So I'll just take 30 seconds.
We need to.
So bladeless
2 minutes.
femto laser.
Femtosecond.
2 minutes, just 30 seconds. So in eye surgery, the excitement is justified because same steps as performed by artificial intelligence. The computerized laser, more precise, shorter bleeding time, shorter healing time, and minimal changes, minimal chances of error, also corrects astigmatism as well, and so better outcomes. And finally, just a word on a recent publication in the Journal of Ophthalmology regarding oxysterol, which is anti-cataract drug. So, any benefit with that, or was it just an experimental drug?
So far, rats have been benefited by that, and I think as long as I continue to work, I will be still be employed till the end of my life.
Right. Thank you, sir.
Big hand for Dr. Dhawan.
Thank you.
On to our last talk, Dr.